When asked about templating, templating is an important concept starting from capillo templating. It helps to select a favorable implant, reduce the amount of inventory available, and help to reduce length discrepancies. Pelvic marker is first is biischial line, second is interteardrop line, and then femoral landmarks on the center of the femoral head and the lesser trochanter. Now, estimate the position and insertion depth of both components by placing the template. Predict potential complications and detect anatomical anomalies. Mental practice enhances surgical technique, helps you to find the neck cut. Teardrop is a landmark created by superimposition of the most distal part of the medial wall of acidulum and the tip of anterior and posterior horn of articular surface, compromise of the quadrilateral surface and cotyloid fossa. Get low AP radiograph. The X-ray beam should be centered on pubis and coccyx, pointing to symphysis. Symmetrical obturator foramina should be present. When doing a radiograph, use trapezium wedge on the floor between the feet of the patient. 10 to 15 degree of internal rotation. Place femoral neck parallel to the cassette. External rotation decreases the offset, creates valgus component. Length discrepancy by the distance between the two parallel lines drawn in the AP pelvis, the interischial line and interlesser tuberosity line, most proximal part of lesser tuberosity. Regarding the templating the acetabulum, draw horizontal line connecting the teardrops. Template acetabulum component first to determine the center of rotation of new hip with inclination of 40 degrees and adequate cup coverage. Medial border of the cup should be approximately ilioischial line close to the teardrop. Inferior border of the cup should be at the level of inferior teardrop line. While templating, appropriate size femoral stem to fill the medullary canal. If acetabular center of rotation is superior to the acetabular to the femur, if acetabular center of rotation is superior to the femur center of rotation and also medial, then leg is shortened and there is decrease offset. If acetabular center of rotation is superior to the femur center of rotation, while it is at the point and not medial lateral, this means leg is shortened. If acetabular center of rotation is lateral to the femoral center of rotation, leg is shortened and there is increased offset. If acetabular center rotation is at the femur center rotation, but it is medial, then it will decrease offset. When the acetabular center rotation is inferior to the femur, while the acetabular center rotation is medial to the femur, then leg is lengthened and decrease offset.